All right, parents, here we go again. It's the Ask Dr. Tony episode. This is the Experience Miracles podcast, and I'm your host, Dr. Tony Ebel, an expert in pediatrics, neurodevelopmental disorders, and drug-free, nervous system-focused healthcare. On this weekly episode, I'll be addressing the top questions on every parent's mind. If there's one thing we love and welcome, it's parents who never stop learning, asking the hard questions, and advocating for your kiddos like none other. So get ready for some real talk, real-life clinical and parenting experience, and real easy to understand answers that will help your family take action and get to that next level of health and healing. You ask, I answer. Let's dive into today's episode. All right, everybody. We are going to, this is the first of a new type of episode and content for you as parents. The number one thing we love to do is to build up, restore your hope. And the way we really get that done is we explain things, we answer your questions, and we don't just dismiss them. We don't just blame genetics and other sorts of things for them. When we say we answer your questions, we really dive deep and we get into the neuroscience and we get into the root cause of why our kids are so sick. So we love to talk about this from a big landscape. So we call that the perfect storm, which is literally the story and the theory, if you will. It's not a theory. It's literally what's happening to our kiddos in sequence of what's happening to cause such a dramatic, truly pandemic rise in chronic illness in our kids. And that's the big picture. That's the 30,000 foot view, which we do here on, all of our platforms and the podcasts all the time. And then we also go granular. I don't know which one I actually love the most. I think probably the latter here. I love when you guys ask very specific, detailed, especially if it's very sciencey, like today's conversation or question, all about retained primitive reflexes. Now, if you've heard about retained primitive reflexes as a parent or a provider, I promise you this, you've heard about them in the exact landscape of saying, that's a root cause. That's a big deal. Let's just really, really put this out there the way they're put forth on Instagram, on Facebook, and a lot of different pages and different platforms, and from many in my profession, functional neurologists, which are almost predominantly chiropractors, right? DCs. You've probably been told, if you've heard about retained primitive reflexes at all, that they are a huge deal because they really are what's causing the nervous system to be dysregulated, to be so dysfunctional, to be stuck in what's called this sympathetic fight or flight storm. And when a child has stuck retained primitive reflexes, which are normal reflexes for an infant to have the first few months, different ones kind of are supposed to integrate and almost go away, you would say, over the course of time when a child is optimally developing neurologically, meaning they don't get stuck in the perfect storm early and often. And so the conversation that's out there on Instagram and on the internet and in lots of other really smart, really caring, really incredible different providers being put to parents at a higher degree than ever, it's here's the statement of the day. This big deal made out of retained primitive reflexes is absolutely accurate. It's just incomplete. It's the same thing I like to talk about, and I'll do a whole episode about neurotransmitters and the whole chemical imbalance theory one day. Neurotransmitter imbalance being blamed for ADHD, anxiety, depression, everything else. It's actually accurate in part of the scientific and neuroscience real root cause of what's causing those things, but it's not the whole story. Neither are retained primitive reflexes. There is a reason that primitive reflexes are retained in the first place. So let me just start where everybody else starts with the science around retained primitive reflexes. It is said to parents and said to other providers, by the way, I was taught this. I'm going to get into my backstory in just a second, but let's get into the surface level science of retained primitive reflexes. It is said that if reflexes are retained, then the child stays in this primitive, so protective fight or flight response. And that is why it alters, disrupts, and delays development. So retained primitive reflexes are blamed for everything from sensory processing and overdrive and overload, why a kiddo would have more meltdowns and more tantrums and more difficulty with sensory transitions and so forth. Retained primitive reflexes are blamed for gross motor delays. So missing milestones, skipping milestones, delayed milestones when it comes to moving the big muscle groups of the body. Retained primitive reflexes are blamed as a root cause trigger for fine motor problems. So things like handwriting, things like speech and oral function, and then visual. So tracking eyes, accommodation, reading, dyslexia, and then retained primitive reflexes, you put that all together, and it's a huge conversation in the autism world because kiddos, traditionally, the majority of kiddos struggling with autism, they struggle with all that stuff, okay? Their neuromotor, gross motor, fine motor, sensory processing, social, emotional, cognitive, they're all thrown off track. So when we look at and we study the sequence of optimal neurodevelopment, primitive reflexes are a big part of that scientific conversation. They are totally normal to be present in an infant. Things like a startle reflex and all that. We're not even going to go into the reflexes because it doesn't matter the details of them. It matters that they are part of the story, but not the whole story. They are a secondary, I would actually argue, not for the purpose of jamming with you guys as parents, but if I'm in a nerd conference, which I'm at, which is where I first learned about these things, and now I'm unteaching, reteaching a lot in our profession about where primitive reflexes really do show up on the map or the sequence of real root cause or not, and whether we should be concerned with them or not. And I'll tell you point blank at the beginning, early part of this episode, people are, and it comes from my profession primarily, completely over concerned with primitive reflexes and missing the boat as to something much bigger and really actual root cause. Retained primitive reflexes are more of a secondary, and again, in the nerd world, I would argue, honestly, even a tertiary component of neurological dysfunction, dysregulation, dysautonomia, and in the world of neurologically-focused chiropractic, we put all of those Ds, so dysregulation, dysfunction, dysautonomia, there's others too, we put them tied together to this thing called subluxation, where the sympathetic fight or flight nervous system is overstressed, overactive due to interference between the brain and the body communicating through the neurospinal system, which is where subluxation sets up shop and creates this vicious cycle and sequence. And so when it shifts the body and shifts an infant, a lot of times this is actually happening in utero during fetal development. That is the first component of the perfect storm. And then birth trauma, physical injury to the brainstem, which is the on-off switch between the autonomic system and where all central neuromotor control comes from, which is where primitive reflexes will then show up secondary or tertiary from that. So when you have a child who is stuck in sympathetic dominance because they are subluxated and their nervous system is out of balance, dysautonomia, retained reflexes are going to be retained because the child's central autonomic nervous system is stuck in fight or flight sympathetic response. So it's actually a normal and pre-programmed response for that child to retain their reflexes, because as long as they're still stuck in the sympathetic storm, they will hang on to their reflexes. Now, carrying out the science a little bit more, as people who make a big deal out of retained primitive reflexes would say, again, accurately, just incompletely, when these reflexes are retained, they cause a continued sympathetic response. They cause confusion, distortion, disruption, and delay of neurological development. And that is true. That is why we've always referred to the big picture behind autism and everything in between in kids as the perfect storm. It's not one thing that causes it. It's multifactorial. And the big deal out of the perfect storm is two additional things that every parent really and every provider really needs to understand. It's not just an aggregate of all these things are bad. It's a specific sequence with which this storm brews. And once it gets rolling, the second thing to know is it's a vicious cycle. One thing causes another thing, and that negative, so one negative thing triggers sympathetic dominance, in this case, triggers reflexes to be retained, and then reflexes go further into the system, trigger even more sympathetic response, more neuromotor distortion, and so they make the situation worse. But they're the middleman. They're not the root cause. Reflexes are secondary, tertiary. I could also kind of run out that analogy of calling them the middleman. So what happens is when providers go full steam at trying to clear and integrate a child who's in this perfect storm, sympathetic dominance, dysautonomic, subluxated state, if we work on primitive reflexes first, and if we go real hot and heavy into this kind of neurointegrative therapy, a lot of exercises, a lot of just this is called functional neurology. If we go heavy down that world first and we get super concerned about retained primitive reflexes, vestibular and visual reflexes, so vestibular issues, visual accommodation issues, and we're messing with reflexes, we're messing with the eyes, we're messing with balance, and we're doing all of this movement-based therapy, and the sessions are 2 times a week, and there's tons going on, and there's probably lasers involved, and more than I could even talk about in this episode. We are actually working on B and C first, not A. Now, I know this to be true. Actually, in my notes, I was going to do this part first, and I skipped it because I'm just so excited to get you the real science behind this. I am trained in all of this. I was a fully trained, I stopped just short of actually graduating from the certification process to become a functional neurologist. This is probably actually going back, geez Louise, carry the 2, getting old, hence the gray in the beard, but 15 years ago. So I went full speed into all this functional neurology training. The reason I stopped short of ever, not that a certification or initials really matter compared to clinical experience, the reason I stopped short of not completing the exam and ever caring to be licensed and listed on the functional neurology directories is because I was already doing all of that in clinic. So I am an obsessive learner and an immediate doer. Okay. I'm like you, parents. I learned something, I'm starting it yesterday. I learned something, I'm taking immediate action. If back then and still today, if it can help me help more kids, I'm going to go learn it and I'm going to do it instantly. So we built this massive functional neurology, multi-professional, multi-integrated. We had an integrated clinic working on neurointegrative exercises, vestibular reflexes, visual accommodation. I worked with a behavioral optometrist who we still love, referred to all the time. I'm going to talk about how to put this all together in the right order at the end. And I did everything. We also went biomedical. We were obsessed with the microbiome, had stool samples and heavy metals, and you name it, we did it. And I know that relates to you guys out there listening because the number 1 episode and the top content on Instagram, Facebook, and the website is when we talk about tried it all and nothing's working. That's this conversation because all the things on the list are probably very, very involved in this root cause sequence. They're very likely very helpful, but not if they're B or C or D or E, and nobody took care of A and the real root cause foundation for your kiddo. So I never went forward and completed that certification in the functional neuro world. I had paid for it, did all that. My wife was super stoked about this decision. She's like, wait a minute, you've taken literally like 150 to 200 hours of seminars and classes already, and then all the studying and reading on your own. You've read Dr. Melillo's textbook 5,000 different times, and you're just going to stop it all together. And we did. I literally cleared out all the different providers in the practice. We stopped doing all the neurointegrative primitive reflex therapies because of this, parents. Our results got worse. The more we did all at once, initially and early in the child's care plan. You got to hear those very, very, very detailed words. Okay. I don't want you to throw the baby out with the bathwater with this one. There is a time and place for every healing modality and intervention. If you do the order and you really get to the root cause, actually, some of them aren't needed at all, which is awesome and should be celebrated. In fact, I'll never forget this. I heard a profession one time say, or a kind of old school chiropractor say, if we could really get ahead of this storm and go through all this, the goal of any profession should be to never be needed. That's, that would be nice if we had no stress, no perfect storm, no birth trauma, no fertility and prenatal distress, and no 42 antibiotics for every ear infection, and, a V word for every disease that's no longer even, been around for 100 years. Well, then we wouldn't have a need. We wouldn't be so stressed. Anyways, I digress. So we stopped doing it all together because our clinical results, AKA getting kids better, got worse. The more we did, the worse our results got. And I think a lot of parents, I get to talk with you guys all day, every day in my clinic, on our DMs, at events. And I get to talk with you and have this conversation every single day. In fact, the more, I just got to say what I need to say, a spade's a spade, science is science. The more we actually messed with primitive reflexes first and early, and the more we messed with the brain before we had the foundations, which I'm going to get to next and finish this episode and this one off with, we actually destabilized the nervous system, and kids would actually have quite a bit of regression and some old behaviors or sensory issues that the family had kind of seen pass on came back up. So so when we started to really go heavy into primitive reflexes and functional neurology, we not only got less good results, we actually started to aggravate some things. And the word that I can now teach you to say what's happening when that occurs is what's called destabilization. Because if you're trying to fix B, I'll say this 50 times here in this one, if you're trying to fix B and C and D and E first, and A is still a mess, the original root cause actual dysfunction within the nervous system, well then trying to force, it's not like taking a medication, that's too far of an analogy, but you have to work on things in the right order. Otherwise, you could possibly not only plateau or not get results, but sometimes you could actually destabilize and get things to go a little sideways and a little haywire, okay? So the conversation around primitive reflexes, I'm going to come back and I'm going to do this exact kind of Ask Dr. Tony episode and session here. And I'm going to do it regarding tongue ties. I'm going to do it regarding the microbiome and cleanses and detoxes, parasites. I live out here on the farm. This week was a massive full moon, and I got more messages about parasites than ever before so we're going to have a parasite and a parasympathetic vagus nerve dysautonomia conversation as well. Not today. We'll save the little critters for another day, okay? So it's accurate. Retained primitive reflexes are part of this neuroscience root cause story, and they do trigger when they're there, they cause trouble, but there was trouble first that caused them to be there in the first place. So I hope you're picking up what I'm putting down. Something else happened first. What is that? When a child, neurodevelopmental sequence, and actually we can even look into a conversation on epigenetics, which is another podcast I need to do. I've reached out to the forefather, the pioneer of epigenetics study, Dr. Bruce Lipton. He actually teaches at the best chiropractic school in the world, which is in New Zealand. So we're in conversation. We're going to get him on the podcast. You're going to have an incredible, if you've never heard about epigenetics, just wait actually first before you want to hear about it from Dr. Bruce Lipton. And when him and I have that conversation, you'll get an incredible understanding. But what we know is that the perfect storm, it's not our genetics that have changed. They take thousands of years, and it's actually not toxins. Toxins, it's like primitive reflexes. Can't throw the baby out with the bathwater. People, don't burn me at the stake here, my friends. Toxins, kids and chemicals don't mix. You'll hear me say that on this platform all the time. They shouldn't be inhaled, ingested, or injected. Kids and chemicals don't mix. These preservatives, these things that go into different medications and interventions and foods, they get into the nervous system. They act as neurostimulatory in a bad way. They're very toxic, very inflammation-inducing, and they trigger the sympathetic response. But what if in today's generation of kids, the sympathetic response, this subluxation, dysautonomia, neurological storm, what if it was already turned on? What if it's already overactive because the fertility and the pregnancy journey was so sympathetic dominant, fight or flight, anxiety, wound up, tension on mom's nervous system, and the wiring, or what's called the tone and the balance of mom's nervous system, dictates the tone and the wiring of baby's nervous system. We actually know through research now from the prenatal and fertility studies, including using technology called HRV, which is heart rate variability, which measures for sympathetic dominance and dysautonomia. So a child who has retained primitive reflexes is going to have a tanked HRV because they were in sympathetic fight or flight first. That's what causes the retained primitive reflexes. And then the retained primitive reflexes make the sympathetic response worst. So it goes sympathetic subluxation first, retained primitive reflexes, and a whole bunch of other things, altered neurodevelopment, disrupted microbiome, you name it. Pro-inflammation, that all comes from subluxation and sympathetic dominance. Now this tree explodes and you've got all these problems. We can talk about them each individually, and we always will on this platform, and we'll talk about them collectively. And then after that, you spit out all these different kinds of conditions, okay? And so to really get to the root cause, you got to come back to the central autonomic nervous system and sympathetic dominance. Well, that is now, we know this from research, it's triggered during high stress, high risk pregnancies. And that doesn't mean like some big medical condition. Like if we look out in this world, we're in the most high stress generation of all of us ever, right? And so this sympathetic dominance shows up first. And even if it was just that, we're not done with the perfect storm, then there's birth trauma. So forceps, vacuum, C-section, the rates of grabbing a hold of a child by their head and neck, yanking and twisting them into the world. There's no other way to say it. Birth is physically traumatic and causes injury and damage to the vagus nerve, the brainstem, the neurospinal system, and it triggers subluxation and sympathetic dominance because the vagus nerve, the parasympathetic, the on-off autonomic air traffic control is right in the neck, right in the upper cervical and the brainstem area. So if you have a high stress fertility pregnancy journey, then that is more likely to end up with intervention, preterm, C-section, emergency C-section, forceps, breech position, cord wrapped. These are all things that trigger subluxation and sympathetic dominance. And now that child is stuck in the sympathetic storm. They're going to get sick more often, chronic ear infections. They're much more likely to have colic and constipation. And so now they're going to get antibiotics. They're going to get Miralax. They're going to get medications and toxins at a higher amount. And that continues to brew the storm and the vicious cycle. Retained primitive reflexes are part of that, but they come because of subluxation and sympathetic dominance and dysautonomia, dysfunction, dysregulation first. So are they a root cause of autism, ADHD, sensory, and all these different challenges in kiddos? They are root-ish, okay? They are close, but they're not all the way down there, okay? So what's the best plan? So the last thing I want to teach you with this one is, okay, let's say we start to put all this together. As a provider, what should providers do in terms of recommending care plans for kiddos? So this is our job to know this, then do this, and then teach and share and communicate this with you, because as a parent, how the heck are you supposed to know this stuff? In fact, it so breaks our heart that parents are being told so much misinformation. That's why we started this platform. It is 100% designed to build your hope and your faith and your confidence first. That is God's number one directive through us to you. Number two, give you the answers and the explanations. And then number three, get here, which is kind of my third chunk of this one, is to say, okay, well, if I've tried everything before and it hasn't worked, what the heck will? Break that down for me. Explain that to me. So give me a couple minutes to give you the sequence of how we get results for kids today. Number one, you absolutely positively must work with a neurologically-focused pediatric and family chiropractor first. Now, pausing there for a second. You're probably thinking, pretty homer answer. Pretty obvious, right? Some of you may be coming in a little bit skeptical to this and go, of course he's going to say that. That's what he does. Y'all, I don't care what gets kids better, just that we do, okay? Anything and everything that helps a kid heal without drugs and get full, optimal, actual recovery, we're game for. Always have been. That's why I went and got 467 different certifications and seminars early on, because my job early in my career, I didn't know this consciously at the time. It's just God's path for me. My job was to figure out what works and what doesn't. What makes me so helpful and so valuable and impactful for your family is I'm not afraid to have both conversations. What works, what doesn't, or what next? Because a lot of times what hasn't worked yet because something else was missing first. And it's like a recipe, right? I always use this analogy. There's a lot of analogies that kind of fit this conversation, but you can have all the right ingredients. And working on OT, PT, primitive, in fact, our OT, PTs understand this conversation. We have this huge community of bosses around here that we work with, and they would literally watch this one, listen to this one and go, yeah, we know that too. They don't worry about primitive reflexes. Not when a kid's getting adjusted and they're doing the movement-based therapy that we then work in tandem in sequence with them. So first things first, at least 30 days. That is, I don't know, I wrote that on my notes because kids that we work with, their nervous systems are so sympathetic dominant, so dysautonomic, so dysregulated and out of balance. It takes at least 90 to 100 days of what we would call kind of high dose, sometimes even an intensive program where it's daily or twice a day, neurologically focused chiropractic adjustments to get that child's nervous system released. So let me teach you the 3 R's. First, we have to release this stuck sympathetic fight or flight response. That's what's causing the retained primitive reflexes. So when we release the sympathetic dominance by stimulating and activating the vagus nerve and parasympathetic system. So the first stage is release. And actually the other side of that coin, the way we release sympathetic dominance is we restore, which is the second R, rebuild, restore, reorganize. We start to activate and stimulate the vagus nerve, the parasympathetic system. We turn development and neurological regulation back online. We work with the autonomic and central nervous system, and our adjustments are not designed to take crooked spinal bones and put them back in alignment. Our adjustments are neurologically focused, and that is a big difference between other sort of physical, biomechanical, chiropractic people and this work. And then functional neurology is awesome. Sometimes they just take it a little too far and start with B instead of A. So if you're seeing a chiropractor who, and moms, don't overcomplicate this one. I am here to bring the truth to you, whether, I get a few DMs from people that are like, I don't know what they're going to, actually I do know what they're going to say. I've had these conversations within my profession for 10 plus years because I did it. So I'm not talking out of theory. I'm talking about a clinical experience and truth. And now we know the science. So I've got clinical experience and we've got the science on our side to say retained primitive reflexes, not as big a deal as a lot of people are making them out to be on Instagram and in their clinic. Because when you get rid of sympathetic dominance, subluxation, and dysautonomia, in about 98% of our cases, we never have to worry about their primitive reflexes, okay? Because we go from that first 90 to 100 days of releasing the sympathetic dominance and the stress, then we rebuild and reorganize this autonomic central nervous system function, balance, regulation. We can track all this via the insight scans. I'm going to give you just a little bit of verbal explanation about those before we're done. And now you've restored balance to the central and autonomic nervous system through chiropractic care all by itself. Once we get this done, sometimes it takes 90 days or so. Sometimes it takes longer. Some kids, it's 6 to 12 months of real heavy, focused, neurologically focused chiropractic care. And it's hard to say, just do one thing when your kiddo is struggling, when your kid's nonverbal, when your kid's having seizures, when your kid's having meltdowns, when your kid's in pandas and going through a flare. What feels right to do is 17 things all at once. Functional med, functional neuro, primitive reflexes, homeopathic, herbal, essential oils, you name it. This conversation that I'm having, which may seem kind of easy and free-flowing for me, based upon my study and my experience over 17 years, I know how hard it is as a parent to see your kid struggle. Now, I've watched my son have seizures. And if I didn't have this training and know this, I probably would have, we don't want to do too little. That's the business of medicine, right? Like, let's watch and see. Wait, maybe they'll grow out of it. They grow into this. But now we're kind of in this world where it's real easy to almost end up doing too much. And maybe that's not the right order or the right way to say it. Just doing things in the wrong order, okay? And so we need space for the nervous system to go through this neurological restoration and healing. And then there's there's kind of this mile marker or stage and junction in care plans and care progress for our patients where we reach what's called neurological stability. Now, the thing I got to sneak in here before we're done is we can track all this. This isn't just tracking symptoms. We are absolutely looking into all facets of a child's neurodevelopment function. How are they sleeping? How are they pooping? How is their immune system? We got to get the basics online before we worry about speech and everything else. So body gets better first, then the brain. I did a whole nother live. We talk about that all the time. I'll get you more information on that if you need. If you hear that and you're like, I want to understand that better, send us a DM and I'll either do another episode all about it or we'll send you some stuff we already have. So you get to this point, and the last thing here to share with you is when we get a child's nervous system through neurologically focused chiropractic care, where the neurosoft signs and the scans are getting better. And these are things we track very ruthlessly, relentlessly detailed, and we communicate with our patients under care. We reach this point called neurological stability. Now they actually have resiliency, adaptability, and reserve capacity into their autonomic and central nervous system. Their vagus nerve, through chiropractic care, comes back online. The vagus nerve in the parasympathetic system is the rest, relaxation, integration, and development side of the nervous system. So in 95, 98, pretty much round up, call it, we don't worry about primitive reflexes, and I haven't for a decade plus, because we do a higher dose, more advanced form of adjusting. That's what I mean to say. That's what really explains this. When a chiropractor is not as experienced or skilled or committed to adjusting, they have to turn to other modalities and other things to try and fill the gap. That's not going to get the same results. Now, from there, once we get a kiddo whose nervous system has restored, reorganized, and we can see from our exams, our scans, and changes in their life that they've reached a neurological stability, they are now ready to heal. It's a whole other conversation called neurological momentum. Now momentum is on their side. Resiliency and adaptability is on their side instead of against them. And now we work with our network of other providers. So now we get to the PT and the OT and the speech therapy team and we say, hey, you got a kiddo with a brand new nervous system. Start anew once again. I want you to literally treat this kid like a new patient, like it's day one. New evaluation, new examination, new care plan, because they've got a new nervous system thanks to chiropractic, and it will work and integrate your care better. What PTs, OTs, and anybody they all know all about retained primitive reflexes. What they tell us all the time is the reflexes are gone. We don't even need to worry about them. By the time we hand over, that's kind of a weird way to say it, but by the time we start to, because it's all about a sequence. We don't do everything. We work in tandem with all sorts of other providers, and we train our PX docs to do this. When we send them out to the PT, OT, and developmental therapy and speech therapy world, I always ask them, hey, did you find any retained primitive reflexes on that kid's exam? At most 1 out of 10 times, they go a little bit, but we're not concerned about it. It should go away once we get them under care. So none of the professionals in the PT/OT world that we work with, and I'm talking literally thousands of cases. This isn't a couple of kids. We've been at it. We've had the busiest pediatric, the most impactful, the largest pediatric chiropractic clinic in the world. And I've been working with these PT/OT, speech therapy, developmental therapy, EI wizards for the entire 17 years. I've always built a community. In the early stages, when I tried to do everything myself and got worse results, I realized stop being a jack of all trades, trying to do everything all at once early. Focus on the nervous system entirely first. And then when these kids need other experts and other interventions to heal, then we go to movement therapy. Then we go to functional medicine. So if you've tried to detox or chelate or cleanse your kiddo or add supplements and nothing has ever happened, your kid can't poop no matter how much Miralax and prune juice and probiotics you throw at them, get them adjusted, they'll poop. No matter how much their immune system is just run over by inflammation and irritation, they're constantly sensitive, skin issues, pandas, you name it, and you've thrown the whole, homeopathic, herbal, functional, neuro-integrative, medical, biomedical pathway at it, and it didn't work, get them adjusted for 100 to 180 days first, then go back to that stuff, and it'll work 10 times better. This is not theory. This is clinical experience. We've seen it in our practice. We can show you the research to really link this all together. And that is enough for this conversation, which was answering the question, are retained primitive reflexes a big deal? They are. They're just not as big of a deal as a lot of other people, including people in my world, same initials, would make them to be, because there's something underneath originally causing them to be retained. That's the real root cause: subluxation, dysautonomia, nervous system dysregulation. That needs to be addressed first. And the vast majority of times when that's done well, so get a chiropractor who doesn't try and do 17 things. Find yourself a chiropractor who is a master of one, a Jedi of neurologically focused adjusting, works on the central and autonomic nervous system directly, because nothing is more potent and more direct to stimulate the brain and the nervous system than an adjustment. Not a laser, not a therapy, not a wobble board, not essential oils. Love them all very helpful. Nothing gets into potently, directly to the nervous system, to the vagus nerve, to the brainstem, and to the brain overall, like these kind of adjustments. I'll leave it at that, and keep these questions coming. Thank you for tuning into today's episode. Do you have a question that you would like to submit? Either send it to support@pxdocs.com with the subject Ask Dr. Tony, or head on over to our socials at PX Docs, where you can submit your question in our stories every single week. Every kid counts and every family counts, so let's leave no questions left unanswered. If you loved this episode and you want to help us reach more kids, we would so appreciate if you left a review and a rating on your favorite platform. God bless. Be well. We'll see you on the next one.